Hi, everyone. I'm Phillip Gu, and I'm currently the IBD fellow at Cedars-Sinai in Los Angeles. I'd like to thank Dr. Ali and the IBD Club for the invitation to present our recent study published in the Inflammatory Bowel Diseases journal entitled Visceral Adipose Tissue Volumetrics Inform Odds of Treatment Response and Risk of Subsequent Surgery in IBD patients starting anti-TNF therapy. I'd also like to thank Dr. Gil Melmed for his mentorship for this presentation. We have no financial disclosures to report. So, obesity has been described as a risk factor for inferior response to biologics, particularly with the anti-TNF class. Possible mechanisms include rapid proteolysis and the anti-TNF sink phenomenon, whereby increased adipose-secreted TNF sequesters the TNF drug. However, clinical studies using BMI have variably shown obesity is associated with inferior response to biologics. This discrepancy potentially reflects the shortcomings of using BMI as a marker of adiposity. To illustrate this, I have two patients' abdominal MRIs. Visceral fat is highlighted in red and subcutaneous fat is in blue. As you can see, the patient on the left has more visceral fat despite having a lower BMI than the patient on the right. So in IBD, visceral fat is potentially relevant because it plays an active role in systemic inflammation through the production of pro-inflammatory cytokines. And a recent small body of literature has found increased visceral fat is associated with aggressive disease behavior, especially in Crohn's disease. So this ultimately raises the question, can visceral fat modify the response to biologics? To address this gap in knowledge, we aim to evaluate the impact of visceral adiposity on anti-TNF response in a cohort of IBD patients and their subsequent risk of surgery. We also want to characterize the role of different visceral fat metrics in relation to different treatment outcomes. We hypothesize that excess visceral fat is associated with differences in anti-TNF response and an increased risk of surgery. We also hypothesize that different visceral fat metrics play different prognostic roles for treatment outcomes. So this was a retrospective study on adults with active IBD seen at 2 medical centers over a 10-year study period. We included patients who were surgically naive and a CT scan within 6 months prior to starting the new anti-TNF agent. Our primary outcome was treatment response based on predefined clinical, endoscopic, and biochemical parameters, and our secondary outcome was surgery. We then quantified visceral and subcutaneous fat volumes using the available CT scans. Afterwards, we performed 2 separate analyses by dividing the patients up by the absolute visceral fat volume and their visceral fat index, which is the ratio of visceral to subcutaneous fat. To determine the independent effect of visceral fat, we performed a multivariable logistic regression adjusted for covariates, including BMI. Afterwards, we performed a post-hoc analysis on drug trough levels to see if this may help explain our findings. So let's see what we found. We were able to include 175 patients, and flare symptoms were the most common indication for imaging, and the mean time between CT and biologic initiation was about 2 months. For the primary outcome, we found that absolute visceral fat volume was associated with TNF response in a non-dose response manner, especially at 12 months. For the secondary outcome, we found patients with higher VFI were profoundly more likely to undergo surgery, especially within 6 months after starting the anti-TNF. In our post-hoc analysis of 41 patients with available drug levels, we observed a significant negative correlation between visceral fat and infliximab levels, but not with adalimumab, and BMI was not associated with trough levels. And finally, we did not observe similar findings with VFI. In conclusion, we found absolute visceral fat volume was associated with anti-TNF response in a non-dose response manner. We also found patients with IBD starting an anti-TNF agent with high VFI were significantly more likely to undergo surgery in the short term. And finally, we found that visceral fat potentially modifies drug pharmacokinetics. While more investigation is definitely needed, we speculate quantifying visceral fat may have a prognostic role for therapeutic outcomes, especially when you consider diagnostic imaging is routinely performed in IBD. I'd like to thank again Dr. Ali and the IBD Club for the invitation to present our study, and we look forward to your questions.